Can you hear me? Okay. Our talk today about rehabilitation from another point of view, or the students of branch campuses, I think they will know that we have a biopsychosocial approach in rehabilitation. What is a biopsychosocial approach in rehabilitation? It is the integration of all the causative factors of disease, that biological factors, psychological factors, and social factors. All these factors gather together to help the physiotherapist or whatever the rehabilitator subject to build up his program of rehabilitation concerning all these factors. As we said, biological factors like immune system diseases, age, sex, virus, infection, behavior, or social, like smoking, drinking, sex life, eating habits. Also sociocultural factors which contribute to these factors of diseases, peer pressure, socioeconomic status. All these factors gather together to get the disease or produce a disease. Biopsychosocial approaches believe that the health and wellness are impacted by a dynamic interplay of factors. Person's mental health is a product of the biological and social and psychological connections. Okay, from the evidence, the practice or of researches, we found that the rehabilitation program based on biopsychosocial approach is more better than the normal or the traditional one. A study done on a breast cancer women and rehabilitation for those women, the rehabilitation program based on a biopsychosocial approach and concerning the psychological and social factors get a more better results than the traditional one. And after 4 years, we found that the biopsychosocial rehabilitation programs, women or patients live more than the traditional program one. Concerning the onset, we stabilize the onset and age and all the factors in this sample. In oncology patients, the biopsychosocial model recognizes that the abnormalities or challenges can arise across the biological and psychological and social domains. So when we get the approach to our patients, we have to take every part of this discipline or these factors to aside and have a deep thinking about these factors. Biological abnormalities, as we know in the cancer patients, women have a biological disease or a biological abnormalities, the presence of the cancer cell inside the breast tissue. Treatment side effects from chemotherapy or radiotherapy, this affect also the biological status of the affected tissue. All these factors must be taken into consideration before we design the program. Impaired physical function after the interference or surgical interference, mastectomy or whatever the interference, this product to a physical dysfunction which affects the physical activity of the patient. So these are together the biological factors shared in the disability of the patient. The psychological abnormalities which affect a diseased patient or the cancer patient, emotional distress due to the disability or the shape discomfort that resulted from the operation procedures, and also depression and anxiety, fear and uncertainty related to their cancer diagnosis and the progression of this process. Body image and the self-esteem also affect our patients. So these are the psychological factors that must be taken into consideration. Social abnormalities, the result of affection of cancer or whatever the disease of the woman or the cancer patient, this affects the social income of this patient. So this interferes to the social level of the patient. So this must be taken into consideration when we start to our rehabilitation program. Okay. For the stroke patient, it is another example. We have to consider the other factors like biological, which physical service focusing on regaining motor function and mobility, such as strength training and gait training. The psychological aspect, cognitive rehabilitation to address memory or language deficits, psychological support for coping with the emotional impact of the stroke. Also, the social aspect as the same as cancer patient, where the stroke patient have affection in his socio-economic level due to the affection of his disease. Orthopedic rehabilitation, it is another example for biopsychosocial aspect. We have to look to the all aspect of this case. Biological, the interference by the surgical operation, interference itself. Also psychological aspects, anxiety and depression post-surgical. Also social, which is encouraging participation in group activities or peer support to enhance motivation and adherence to rehabilitation program. These are three models for the biopsychosocial cases in biopsychosocial rehabilitation. It is important to note that the biopsychosocial abnormalities experienced by oncology patients are highly individualized. Each patient experience may vary according to the nature, the onset, the age, sex of the patient. So we have to build our rehabilitation program, a personalized rehabilitation program, not a generalized one. Okay. This is same. Okay. For a strategy of biopsychosocial rehabilitation programs, we have many strategies, which first, comprehensive assessment. We have to assess each or everything in the patient before we put our plans or imagination about the rehabilitation program. Patient-centered care and not a medical or therapist-centered care. We have to share the patient opinions in our program of exercises or program of rehabilitation, and patient-centered care is more effective in rehabilitation, more the medical model. Education and empowerment, patient education about his pain, about his onset of disease, about the progression of the disease, also assist and help in the rehabilitation program. Collaborative care, which is a multi or interdisciplinary approaches, which we have to cooperate with different approaches and different disciplines who share with us in this case or in the rehabilitation program. Social worker, psychologist, and medical or physician, nurses. This is the collaborative approach care. Psychosocial support, in case we start our program of rehabilitation and suddenly we have no progression or no improvement in our case, we have to seek to the psychologist for psychological referral or psychological support for our patient. Behavioral changes strategies.
1 minute.
Behavioral changes, also when we fully engage our patient with us, we have to teach our patient a behavior which help him in improving his states. Health promotion and prevention. Prevention is better than affection, as we know. So to teach our patient the preventive approaches or preventive protocols to help him to get away from the disease. Referral and networking, when we feel that our patient is not progressing, we have to refer back to the physician and get his advices and complete on the new prognosis or new diagnosis. Thank you.